Hey, I'm Joe, and I'm here at Victory Wellness, and I'm here with Dr. Magdalena Kirshner, and we want to know what's new and exciting in weight loss. How do you lose weight, and what are doctors and pharmaceutical companies doing to help us?
Well, Joe, it's very exciting because actually recently FDA has approved several new medications that are helping us with this post-COVID weight.
Yeah.
You know, one is semaglutide peptide, which is an injectable only once a week, regulates insulin, suppresses appetite, and helps us lose weight quickly. Actually, I'm trying it out now because I couldn't lose the 15 pounds post-COVID. I've been fighting and fighting.
It's hard to get that off.
It's hard to, especially as we get a little older, it's very hard to get that off. So I started the peptide last month and I'm 10 pounds lighter already. So I only have 5 more to go, which I can do it.
Yeah.
It's melting pretty quickly, so it's not a difficult thing to do. Then FDA approved Plenity. It's another medication for weight loss that helps you to keep full in case you can't take other medications. And then we have our usual appetite suppressants, hormone-assisted diets. So here at Victory Wellness and Medspa, we have something for everybody based on your preferences, choices, and medical conditions. Some people cannot take certain medications. Yet losing weight is highly beneficial to their health.
So the peptide it's an injectable, you said. How many do you get total, or can you keep running on the?
Actually, interesting thing about semaglutide that was approved by FDA is also approved for maintenance of weight loss. So, especially those of us that are very overweight, we have a hard time maintaining that weight because of our insulin resistance. We're pre-diabetic. So, if semaglutide works for you, you do lose weight, you can continue on to maintain that weight because it's so much beneficial for your health to be optimum weight.
So this is one of the options if a patient comes in for medically supervised weight loss. This would be one of the options for them. The shots.
Once a week. It's a little shot, like it's actually a diabetic medicine. So it's a little shot only once a week. That you have to remember to do it, and it helps you to literally melt away pounds. Like for me, it just literally was starting after a while. Every time I stopped on the scale, I was disappearing, and my pants fit, my jeans starting to fit. I'm loving it. You know, and of course, after low carb diet, keto diet, we're gonna have to, or maybe Weight Watchers, we have to tailor and custom a diet that works for us to stay lost.
And that's what the medically supervised weight loss program does. They come in weekly, check in with you, get their weight done, get their levels done, their blood work done, and then you tailor the program specifically to them.
Yes, so we do blood tests. We make sure that your metabolic function is optimized. We screen you for different things, and just make sure that you lose your weight in a healthy weight that's beneficial to you.
So I was looking at your YouTube channel, and I saw some really good testimonials about the weight loss program. What do you think the biggest loss you've seen for your medically supervised weight loss? Who lost the most? How long did it take? Anything like that?
I think about 120 pounds.
Oh my gosh.
Yeah, we had a lady that came in and she stuck to her diet and the medication, and she actually kept it off too.
Oh wow,
beautiful.
Yeah, that's
not
the hard
just
part.
lost, but she kept it off. We have people that have lost 100 pounds plus.
Oh geez, yeah.
Sometimes that we gain some. We always encourage you when you put on just a little bit weight, come right back.
Okay.
Don't pile on 50, 100 pounds. It's hard to lose that versus 10 or 5 pounds.
Yeah.
So intervene. AMA classified in 2013 obesity as a disease. It's a chronic disorder. So there's, treatment and then maintenance of the relapse, as they call it. So when we relapse because we get maybe very stressed, our cortisol is pumping, we put on that weight back. So let's intervene quickly as opposed to late when we put on too much and have to start the whole process over.
Okay, and you mentioned blood work, and you're an aesthetic clinic. Blood work checks people's hormone levels.
Yes.
And weight loss isn't just about the pounds, it's about their hormone levels, and it affects how they feel. So this could also tie into depletion of hormones when they're aging. Is that correct?
Oh, absolutely. That as we lose our hormones, we're aging, both for men or women. Women go through the menopause, men through andropause. So, for example, testosterone is crucial in maintenance of weight because testosterone speeds up metabolism, favors muscle buildup, decreases the visceral fat around the belly.
Okay.
So when that gets too low, both in men and in women, we start piling on weight here. Same with estrogen, progesterone for women. When our hormones are optimal, when we are younger, we have much less difficult time in controlling our weight, losing weight, or staying
you're
lost,
skinnier
right?
when you're young.
Same with insulin. Insulin is much more efficient when we're younger.
Okay.
Thyroid's much more efficient. So this is what we try to do by doing the labs. We try to identify the hormonal deficiencies as well and optimize the body, optimize the function to help you succeed.
Yeah, and I wanted to touch on that because all the diets out there, this medically supervised weight loss, the hormone levels, the tests are just critical to losing weight. I mean, knowing what your body's doing, having a program that's tuned to your body is going to help.
Absolutely. For example, if you have a patient that thyroid is, I call it lazy.
Yeah.
Lazy thyroid.
Lazy
it's
thyroid.
Not so bad that you're sick, you need to be hospitalized, but it's just lazy, doesn't want to work quite well. Well, what thyroid does, it's an engine of the body. It burns calories, thyroid, and determines how fast we're going to burn calories. If we don't optimize the thyroid, what's going to happen? We eat and our food turns right into fat because we're not burning.
Yeah, that makes sense.
So if our insulin gets lazy as we get old, it's called insulin resistant. We're not diabetic yet, for example.
All right.
But we have lazy insulin already, which most of us after 40 do,
Yeah,
by the way.
You
Probably
age
80% of
slower.
us. Exactly. So when that's not optimized, then what happens, we're not using our blood sugar for energy. Insulin is not putting into the cells for energy. It's putting it away for fat.
I gotcha.
And so our body literally works against us. So no matter how much we diet, how much we try, we're not succeeding. And we see this all over. Today.
And the medically supervised weight loss is available in Cincinnati, and you have a clinic in Naples.
Naples, Florida. Mm-hmm.
And they a patient would what? They would just call and schedule an appointment?
Yes, give us a call and schedule an appointment, either telemedicine or come in person here. And we can go over the basics and what you personally need, send you to the lab, give you a lab slip, and after your labs are done, we either issue you a prescription or you come in here, we teach you how to inject yourself if you need. You can come here to be injected. There are people that are squeamish.
Yeah, they're squeamish.
They don't want to inject themselves, then you can come here, we'll do that for you. So there's many, with some of the medications, you have to be seen in person, especially for the first prescription. So it just depends on state regulations and preferences.
And they can find both websites in Cincinnati, victorywellness.com, in Naples, Florida, victorywellnessnaples.com.